right. Well, good afternoon, everyone, and welcome to the Georgia Department of Community Affairs 2020 Fall Conference. We hope that you are enjoying our virtual format and the earlier sessions. The topic of this session is the CARES Act funding, and our panelists for this afternoon are Corin Thornton, DCA's Regional Community Services Director, Joni Perry, Division Director of DCA's Community Finance Division, John Shirakis, Senior Manager, DCA's Office of Homeless and Special Needs Housing, and Miriam Goulburn, DCA's ESG Program Coordinator. We're going to jump right into this session, but first, just a few housekeeping tips. Please be sure to keep your mic muted during the session. If you have any questions during the session, feel free to type them into the chat. We will save all questions until the end, and I'll read them out during the question and answer portion of the presentation. Otherwise, there will be an opportunity for you to use the raise your hand function during the question and answer session as well. Also, if you have any questions during the session, feel free to type them into the chat and we'll try to pick them up. This session will be recorded and will be available after the conference to you and others who are unable to attend today's session. You also will receive an evaluation immediately following the presentation, and it will also be mailed to you. Please complete it because we do value your feedback, and we thank you for attending today's session. So I'll go ahead and turn it over to Corin to begin.
Good afternoon, everyone. I'm Corin Thornton. As Tanya said, I'm the Director of the Office of Regional Services at DCA. And I'm going to give a little bit of background on the CARES Act and some of the ways that the CARES Act has already been deployed in the state of Georgia and the way that DCA was specifically involved in some of those efforts. As many of you know, the CARES Act was actually passed into law back in March of this year. And it was really one of the biggest pieces of assistance legislation ever passed. It's a total of $3 trillion in funding, which is somewhat significant. And March 27th was the date that the legislation was passed, and a lot of the funding basically started to flow pretty quickly after that. The first tranches of money that were available were through some of our small business assistance programs, and also through the Coronavirus Relief Fund for local governments. As I mentioned, it was $2 trillion to provide assistance for families, workers, businesses, and local governments. So it's a very comprehensive package of assistance. And I want to just take a step back for a minute and think about, we're talking a lot about money and programs and that sort of thing, but the entire purpose of this CARES legislation was to help people. Like many of the programs that we utilize and deploy at DCA, the real purpose is to provide assistance to people. Well, as I mentioned, one of those first programs that came online was the SBA emergency loan programs. And that was designed to basically make sure that our small businesses could keep going during this time of unprecedented uncertainty. And so one of the chief concerns that Governor Brian Kemp had was that we as Georgians and those of us in state government, that we could make sure that this money got to the people that needed it the most. A lot of times when we talk about small business loans, a lot of our small businesses think they're eligible for whatever reason. And so in a way that really demonstrates how resilient and how collaborative we are as a state, the Department of Community Affairs and the Department of Economic Development partnered with the small business development centers at UGA to help get the word out about the SBA emergency loans. Now, the emergency loans themselves were really leveraging the robust network of small business lenders throughout the state and throughout the nation, in fact. And so we had lenders who were at the ready, and we wanted to make sure that we did our part to get the word out about these programs. So very quickly, the UGA SBDC offices around the state created some training platforms using Zoom, which at the time, think about this is early April, Zoom was still pretty new to a lot of us. And DCA and Department of Economic Development co-hosted these webinars virtually around the state. And we also really helped to get the word out because, as I mentioned, one of Governor Kemp's chief concerns was that these funds were being accessed by the people who needed them the most. And we talk a lot about these are small business loans, but the purpose was really to keep businesses going and to keep people employed and families fed and people
I'm
happy.
sorry, just a minute.
So those SBA loans actually took several different forms, and chief among those, there was an economic injury disaster loan. There was a economic injury disaster loan advance, which was more of a grant. But the program that got the most publicity and actually has really done the most good probably is the Paycheck Protection Program, the PPP, which is kind of a fun thing to say. But this was a program that was really designed, as it says, to keep people paid and employed. And so it was available through loans to small businesses, initially just to keep people on the payroll, to help pay payroll and to cover some other necessary expenses. When the program first launched, it was really designed to be an 8-week program, because back in March, no one really knew what Corona was going to look like and how long it was going to last. But then, showing how everyone can be resilient and adaptable during this time, the program was changed in June to cover a 24-week period. And this program is actually a forgivable loan if those jobs are maintained for a certain period of time, because the idea behind this was to keep people in their jobs, keep people working, and as that happens, they can feed themselves, they can house themselves, they can support other small businesses. And in Georgia, this program, as of August, had reached about 175,000 small businesses, and that really does run the gamut from sole practitioners. You might be a self-employed individual and would have been eligible for these funds, to businesses up to 500 in employees. That is an SBA definition of small business. And the number of the investment in Georgia under this program is $16 billion. So that's very significant. And that's helped a lot of businesses, but more importantly, help people and help families. If you're interested in just kind of looking at some more information about that program, I did provide a link to SBDC's website that they have devoted just to these SBA loans. Now, the other way that the state became actively involved in deploying CARES Act funding initially was through the Coronavirus Relief Fund. It's a mouthful, so if any of you have had any experience with this program over the past couple of months, you've probably heard us refer to it as CRF. For a lot of our local governments, this is their main contact with CARES Act heretofore. There have been some other programs available for schools and other entities, but this is the primary program for local governments. The larger cities in Georgia, well, the largest city, the city of Atlanta, and then the largest counties, those of 500,000 in population or greater, got their funding directly from Treasury. The balance of the state, those funds were deployed through the Governor's Office of Planning and Budget in partnership with DCA and the State Accounting Office. And basically between the end of July and September 1st, we rolled out $366 million to local governments throughout the state. And this fund was expressly to help local governments offset costs associated with the COVID pandemic. Now, these were costs that could not have been in your budget, so they had to be unbudgeted expenses. And they were designed to, they couldn't be used to offset revenue. They really were to use to recoup costs of fighting the COVID pandemic. And eligible expenditures ran the gamut from PPE and sanitizing public buildings to maybe hiring more employees to more safely run elections. And also the bulk of the funds were probably used to pay for public safety payroll, because that is something that the U.S. Department of Treasury decided was a, kind of a special exception. For those of you that hadn't been part of that with our local governments, this is kind of how the program rolled out. The Office of Planning and Budget through the State Accounting Office made an allocation available to local governments. It was based on per capita, and they got an advance payment up front that they then had to reconcile to show that they had accounted for those funds properly. Once they had accounted for that first 30%, the remaining 70% of their allocation was available through a reimbursement basis. So $111 million went out the door in that first 30%. And then the remaining 255 was based on a reimbursement basis. So 366 million in 6 weeks is moving quickly for state government, for local government, for all parties. And DCA's role was to be a point of contact, to answer questions, and also to do that first level of review. These are Treasury funds. They are, have to meet certain guidelines, and so we had to just kind of look at documentation and make sure that the funding is available. I will say that we could not have done what we did so quickly without the help of our partners at GMA and ACCG. Were very helpful in providing a lot of technical assistance and training also to our local government. And if you're interested in seeing how these funds were deployed or how much each local government received and how they spent that, the Office of Planning and Budget has maintained a CARES Act website that includes a lot of really great reporting. You can look at it by state service delivery region. You can look at it by the categories of expenses. You can really look at some great information, and it really shows how state government working with local government can work quickly to address some very specific needs. And we hope to see more good come from this program. These are just the two first examples of how Georgia has rolled out the CARES Act money. And so we just wanted to provide this information to frame what you're going to hear next, because this is just the beginning of a very robust piece of legislation and piece of funding. Thank you.
Thank you, Corin. I think we are now set to hear from, let's see. Jenny?
ESG and HOPWA are going next, John and Marion.
Oh, very good. Thank you.
Okay, so good afternoon, everybody. Again, welcome to the Department of Community Affairs DCA Fall Conference. Thank you so much for joining. Welcome. And my name is John Shirakis. I am the Senior Manager in the Office of Homeless and Special Needs Housing at DCA. I do have a co-presenter today, so I'll allow her to introduce herself. Marion?
Thank you, John. Good afternoon, everyone. My name is Marion Goldburn, and I am the ESG team lead, also in the Office of Homeless and Special Needs. Welcome, everyone.
Okay, and we are here today, and thank you, Corin, for that great introduction to the CARES Act. I think that was a lot of very valuable information there, and we're going to build on that right now. In talking about, in particular, two programs that are funded by HUD, typically the Emergency Solutions Grant Program, or as it's abbreviated, ESG, and the Housing Opportunities for Persons with AIDS Program, or as it's known shortly, HOPWA. So these are the two CARES Act funded programs that we're going to talk about. Both of these programs are regular formula grants from HUD that are passed through to states on an annual basis. But the CARES Act really recognized that there was a greater need potentially for people experiencing homelessness and people who are already in sort of dire straits under the circumstances. The pandemic and the economic downturn just sort of exasperating the situation for that particular population. So both programs, the ESG program and the HOPWA program, received significant sort of bonus amounts under the CARES Act. Just to give you an idea of the magnitude, the ESG program's annual allocation is typically about $4.3 million a year. We received 2 different allocations, and we'll talk a little bit more about that later, under the CARES Act for the ESG program. The first one being roughly $15 million, and the second one being $29 million. So compare that to an annual allocation of $4.3 million, and it was a significant increase in funding and much needed. So it's been a whirlwind 6 months or so in terms of trying to get that money out to the public and in the hands of agencies that are able to provide services. But before we really get started on the CARES Act portion of it, we don't know how familiar people are with these 2 particular programs. So we're just going to give a little bit of background on what the ESG program and the HOPWA program are, and just to give you some sense of what the programs can do. So I'll let Marion cover the ESG program in a nutshell. Marion?
Thank you, John. So as John said earlier, the ESG is a formula grant from HUD that is allocated annually, and this is to serve those that are homeless or at risk of becoming homeless, and also low income. And so this grant is given to DCA, and we allocate these funds to nonprofits, local government, United Ways, and community service boards. So the ESG program provides funding to engage homeless individuals and families that are living on the street. It also improves the number and the quality of emergency shelters for these homeless individuals and families. It helps with shelter operations and also services for shelter. One of the other components of the ESG is the rapid rehousing, and this is to rehouse individuals and families that are literally homeless or living on the street or in shelter. Another component is the homeless prevention, and this is also to prevent homeless families and individuals from becoming homeless. I'll turn it back over to you, John.
Okay, thank you, Marion. So that's just sort of ESG in a nutshell. There is a link here on the slide to an ESG fact sheet that's housed on the HUD Exchange website. So that's a useful resource if you want to learn more about the nuts and bolts of the ESG program. I do believe all of these presentations will be made available afterwards at some point, so you will have those live links when you receive them. So what is the Housing Opportunities for Persons with AIDS program, or HOPWA for short? It's very similar to the ESG program in a lot of ways, except that it targets low-income persons who have a positive HIV or AIDS diagnosis. In this instance, low income is defined as 80% or less of the area median income. While it's not specifically a homeless program per se, many, if not most of the individuals that avail themselves of these services are homeless. So there's a lot of crossover between HOPWA and ESG. HOPWA just serves a much narrower, more specific population. It can do many of the same types of things that the ESG program does. It has a number of different types of housing interventions available to it. It provides short-term and long-term housing, which could be anything from an emergency shelter, short-term stay, emergency lodging in a hotel or motel. Could be tenant-based rental assistance, whereby a client has a lease in his or her own name, and financial assistance and supportive services are provided along with that. Or it could be more long-term housing assistance, such as a facility-based, project-based type supportive housing program. It also has homeless prevention components to it. Unlike the ESG program, the HOPWA program can actually assist not only people who are behind on their rents and utilities, but also people who've fallen behind on their mortgages. That's one difference between the two programs. And with the HOPWA program, housing is really viewed as a health intervention. People living with HIV and AIDS experience homelessness at a disproportionate rate compared to the rest of the population. And it really is necessary to have stable housing in order to maintain healthy treatments and get the medical treatments and supportive services that are needed to live with the disease. So housing is definitely seen as a medical intervention within the HOPWA. A great overview of the CARES Act in general. In relation specifically to the ESG and HOPWA programs, the language that HUD uses over and over and over again in its written materials and also verbally through meetings is that these funds are really intended to prevent, prepare for, and respond to coronavirus. So that's the primary intent here. They're funds that are to be used to mitigate the impacts created by coronavirus and the corresponding economic downturn in order to, stem the tide of homelessness, keeping people in their homes who may have lost jobs or had seen reduced income as a result of the pandemic. And then also to care for the people who are currently homeless or in shelters who may be at more risk of exposure than some of the general population. So at this point, we're going to take a break for a quick poll. I will turn that over to Dana and Marion. Dana?
The poll has been launched. About half of you have participated. We'll be closing the poll shortly, so if you would like to vote, please do so now. Marion, if you would like to go over the results.
Okay, so the poll results are in, and 50% of our viewers state that yes, they are aware that the funding was released and available in their communities. 33% said they were not, and 17% were unsure.
Okay, great. Thank you for those responses. And that's kind of eye-opening. That's roughly a third or possibly more of you who have not heard about this. So definitely we want to educate as many people as possible about what we have available through these two programs throughout the state. And that's what we're going to move into next. So at this point, I will turn this portion of the presentation over to you, Marion.
Thank you, John. Okay, so as John stated before, DCA was awarded ESG CV funding. There were 2 rounds of funding that were allocated by HUD to DCA. In the first round, which was on April 2nd, 2020, we received $15,920,176. Then on June 9th of 2020, we received our second round of ESG CV funding in the amount of $29,498,276. And these fundings are available through September 30th of 2020. We also received a round of HOPWA CV funding on April 2nd, 2020 in the amount of $562,987, and the HOPWA CV funding is available through September 30th, 2023. We're going to talk a little bit about our strategy for allocating these funds to the communities, the agencies and communities that we're serving. Between April and July of 2020, we identified agencies that we have worked with in the past in order to gain the geographic.
I don't think you need that much tinfoil, so that sheet should be. Okay, we'll take whatever you need from that sheet.
There is someone.
No, I have more tinfoil, so you can use take tinfoil.
So sorry.
Oh no,
Marion.
nope.
Marion.
Perfect.
I'm so sorry to interrupt the presentation. It sounds like someone is not muted. If you could mute yourself, please do so. Thank you.
Thanks, Dana. So we'll talk a little bit about how our funds were allocated, what was the funding strategy for the ESG-CV CARES Act funding. Between April and July of 2020, we identified high-capacity agencies that we have worked with in the past in order to gain the geographic coverage for the state that we needed. So many of these agencies also aligned with the Balance of State Coordinated Entry System. And coordinated entry is required for agencies that are utilizing ESG and ESG-CV funding. Between June and September of 2020, after the initial agencies were identified, there were still some coverage needed in some of the counties that we cover. So the second strategy was to approach agencies in these uncovered counties so that we could fill those service gaps. From August through December of this year, we plan to target specific populations with the project types that are covered under the ESG-CV grant. So we have approached Georgia Legal Services to help to provide homeless prevention services, and they will be able to do this on a statewide basis. We have also entered into discussion with stakeholders as we would like to target the youth population and also use some of this funding to do employment assistance. So just referencing back to the slide, the previous slide, in April, we identified the project type. Between May and June, we solicit the application and conduct one-on-one discussions with these agencies. Between July and September, we went into the contracting phase, and we also conducted implementation workshops to help the agencies to successfully carry out their ESG-CV funding. Between October and December, we'll be working with these agencies very closely. There are some reporting requirements that are required by HUD on a quarterly basis, so we will work with agencies to get these reporting done. We'll also be doing some monitoring to ensure that the project types are being implemented successfully and that they are also spending down on these funds that they're awarded. And we also plan to do future planning in order to help us to execute these grants. So with our funding, we did 2 rounds of funding with the ESG-CV project type. In round 1, we concentrated on the street outreach, emergency shelter, and homeless prevention project type. We awarded $203,100 in the street outreach, over $1 million in emergency shelter, and over $3 million for homeless prevention. So we spent a total of $4.2 million in our round 1 funding. In round 2, we identified additional agencies, and we funded not only the street outreach, emergency shelter, and homeless prevention projects, but we also funded the rapid rehousing project type and the homeless management information system, which is a database that is used to report out on the project. So in round 2 for street outreach, we allocated $684,632, a little bit over $1 million in emergency shelter. For rapid rehousing, those agencies that were funded in round one, that were also funded for rapid rehousing, were funded in round two, along with our additional round two applicants. And so for rapid rehousing, we did $4.3 million. And for homeless prevention in round two, we did $757,177. In round three, we are funding Georgia Legal Services to provide homeless prevention services. And so we will start off by funding them for a little bit over $10 million.
Okay, thank you, Marion. We do have an interactive map that will show all of the coverage of the ESG CARES Act funding and how to access those funds coming soon, hopefully by the end of this week. So we'll make sure that a link to that map goes out to everybody here at least and more. We really want people to disseminate that as widely as possible. It's going to be a great resource. There is a screenshot there. We do sort of have a prototype that we're working on. It's not finished yet. All of this is sort of a work in progress, but it shows that, you know, if you click on a city like Albany or Doherty County, what you'll get is the name of the agency that's covering that county, the types of services they're providing, a contact person and their contact information. And then in areas where maybe agencies overlap a little bit, there could be additional agencies listed as well. So that will show all of our coverage around the state. It's color coded. You can see a few colors peeking through there by the regions that the agencies are covering. So Southwest Georgia Community Action Council is serving a number of counties in Southwest Georgia and so on. So we hope to get that map out to everybody relatively soon. It'll be an excellent resource. You can just refer to that and know which agency is providing CARES Act funding through the ESG program in that particular community. All right, so a little bit on what the HOPWA CARES Act funding strategy looked like. We were actually under some tighter time constraints with the HOPWA funding. The CARES Act stipulated that all HOPWA funding had to be fully obligated within 2 weeks of the signing of the agreement with HUD. That agreement was signed on June 2nd, so all HOPWA contracts had to be fully executed by June 16th. We did achieve that. And you may be wondering, I think on an earlier slide, we indicated that the HOPWA funding became known on April 2nd. So why was there a gap in the number of months between April and June before the actual agreement was signed? Because what we left out here is there were a number of steps that we had to go through in order to get to the actual agreement with HUD. We had to amend our annual action plan. We had to post it for a week for public comment, and all of those types of things took a little bit of time. So we didn't actually receive the funding until after that agreement was signed, and it was a similar situation with the ESG program. So our strategy was to work with existing providers. The DCA HOPWA jurisdiction covers 125 counties throughout the state. There are 2 other jurisdictions. So we solicited applications from our existing regional partners that cover those 125 counties. Only 6 of the 12 sponsors responded to the request for applications. That might seem odd, but the other 6 indicated they didn't need the funding because they had other avenues of CARES Act funding through other sources that they could avail themselves of. And so this funding became less necessary for them. The primary funding source in that way being Ryan White program, which is a public health program that can also provide some housing support and short-term housing types of assistance. And so it's important to keep in mind that the ESG funding and the HOPWA funding, and later we'll hear about CDBG, and Corin talked about a few other programs. These are by no means fully comprehensive of what's contained within the CARES Act. So many other funding streams that don't necessarily flow through DCA are also assisting these same communities and funneling through some of these same agencies. And so after we got everything contracted, we conducted implementation workshops, and those agencies are now currently providing services. And so again, just sort of the timeline here, early on, soliciting applications from our current project sponsors, discussing those applications, even talking to the agencies that didn't apply to make sure that they hadn't just missed the deadline or something like that. Very quick contracting period, getting everybody up to speed through implementation workshops. And now we're in a sort of reporting and monitoring phase. And of course, all of the agencies delivering services. And again, this grant goes through September 30th, 2023, whereas ESG is only for 2 years. And this is a list of the 6 agencies that did apply for funds, and I do believe all of them received what they asked for. So you can see they're relatively modest requests. The HOPWA funding was a little bit over $500,000. Might not seem like a lot, but it's certainly not a drop in the bucket. You know, doesn't seem like a lot compared to the ESG allocation, but it's still a significant amount of money. And you might note that that DCA retained some of those funds in order to implement them statewide, which is allowable under the HOPWA program. And we do have an interactive map for the HOPWA program available. So hopefully I can click on this. Hopefully you can all still see my screen. And this shows you a map of Georgia. The colored in, shaded in areas show the regions that our project sponsors cover. The sort of blue outlined area centered on Augusta is the Augusta jurisdiction, and this sort of pink outlined, whited out area is the City of Atlanta jurisdiction. But again, you can click on any county that DCA covers, and you'll get the contact information of the agencies serving that area. And even in the areas that are outside of our jurisdiction, you can get information about who to contact there. So that's sort of a snapshot of what's also coming for the ESG interactive map. So that's a very handy tool. And we're going to pause again for another poll. This is going to be a 2-part poll. There's one lead-in question and then a follow-up question. So I will turn that over again to Dana and Marion.
The first poll has been launched.
Okay, so the next poll question say, are you involved with efforts to end homelessness in your community? And so this is a yes, no response.
We'll be closing the poll in a few seconds. If you haven't voted, please do so now.
Okay, and so we have the results. And so 40% says yes, they are involved with efforts in the to end homelessness in their community, and 60% respond no.
Next poll has been launched.
Okay, so a follow-up question is, if you have answered yes, how are you involved? And so you would check all that applies. And so the options are volunteer, work at nonprofit or homeless service provider, a religious institution, local government, or other.
Only about a third have responded. We'll give everyone a few more seconds to do so.
Okay, so we have the results of our poll of those who answered yes to being involved in homelessness in their community. So we have 21% that are involved as volunteers, 29% work at nonprofit or homeless service providing agencies, 13% are involved through religious institutions, 42% through local government, and 29% through other involvement.
Great. Thank you all for those responses. So it looks like we've got for those who are currently involved, it looks like we've got a pretty good mix of folks coming from different walks of life, and involved in different ways. But for those 60% of you who said you are not involved, maybe you do want to get involved. So these are some ideas about how you can get involved in your community, how you can be an active participant in creating a solution to homelessness in your communities. In the essence of time, I'm not going to walk through all of these, but just really quickly, a lot of times people in the homeless population don't have a loud voice. So advocacy is an important way to get involved. Advocate on behalf of those experiencing homelessness and also the providers that try to help them. Get involved with local homeless coalitions. There are coalitions existing throughout the state. You just need to find out when and where they meet. Make yourself aware of resources. If you're not aware, then you're not able to refer people effectively to resources when you encounter them. I have 3 resources listed there. The coordinated entry sites are posted on the DCA. These are active links, so you'll get these in the electronic version when you receive the presentation. The coordinated entry sites, Marion talked a little bit about that. So anyone experiencing homelessness in a place where coordinated entry exists can avail themselves of those sites and get placed into available housing through those means. We also, starting in March, started a resource identification committee in our office. They've done a yeoman's job of collecting various resources related to the pandemic and how to respond. You can see there's a variety of types of assistance available, not only housing, information about the CDC eviction moratorium that's in place through December. There's just a wealth of information available there. And then finally, this is an email address we set up. We've seen a vast increase in the number of requests coming from constituents in need of assistance. Anyone seeking assistance who can't find it in their local community can email us through this email address, and they'll get a response with some suggestions and resources, usually within 24 hours, I would say, within a working day. Also support your local agencies in whatever way you can. If you're involved in a nonprofit or a faith-based organization, collaborate with the wider community. Don't work in silos, and participate in the point in time count. I think there's another session during the course of this conference on the point in time count, and learn more about the coordinated entry system in your community. And that's it for us. We hope to see you in person next year, possibly in a place somewhat like this. Don't know, but that would be our hope. And again, thank you. You can contact Marion and I at these email addresses. And again, please type your questions in the chat box. We will have a short Q&A session at the end. Thank you very much. And now I'm going to turn it over to Joni Perry, who's going to present on the Community Development Block Grant and how it relates to the CARES Act. Joni?
Thank you, John. Again, my name is Joni Perry. I'm the Division Director for the Community Development Finance Division, and this is the division at DCA where most of our community development and economic development financing is housed. And today I want to talk to you about how this Community Development Block Grant Program, or CDBG, was funded as a result of the CARES Act. This is our newest funding source in the division. We will not be as far along as our friends in the ESG and HOPWA funding. HUD was rather slow to provide guidance on how to use these funds to all their 1,250 grantees. And this did not come out until late August, so we are still in a planning mode, and we hope this provides an opportunity for you to help in that planning. Today, I'll provide a brief overview of the program, the uniqueness of the funding, how we as a state are exploring several options on how to use the funds, our next steps, and we will also ask if you could, we're soliciting your input into the potential uses of these funds. So if you would do so by putting these into the chat box. So CDBG activities, if you're familiar with the program in general, those same activities are eligible. But as John pointed out when we were talking about the CARES Act in general, as far as how it relates to ESG and HOPWA, that same thinking and by statute applies to CDBG. Those activities are generally eligible to the extent they prevent, prepare, and respond to the coronavirus. CDBG has always been an important tool to support communities and how they can address community development and economic development needs. This new funding resource provides additional CDBG resources to address COVID-19 through this CV program. The Act, which was in the CARES Act, which was enacted on March 27th, allocated funding to 1,250 states, local governments, and other territorial agencies. So that's a lot of grantees that HUD has. And HUD expects grantees to fund thousands of different activities that may be appropriate to their jurisdictions to prevent, prepare, and respond to the coronavirus with this funding. To address these challenges, the CV program are flexible enough so that funding can be used to pay costs that are not covered by other funding sources for assistance, to the extent that they principally benefit low and moderate income persons. So how does CDBG compare to CV? The differences are, for CV, HUD is allowing waivers and alternative requirements for CV. And I'll tell you that states were provided the opportunity to request waivers from HUD. The state of Georgia was very aggressive in what we requested as waivers. And we kind of think that perhaps some of the delay in HUD being able to provide guidance was because they took our comments into consideration. Other states were also very aggressive. Some of the alternative requirements that have come out is that they're allowing virtual public hearings as long as we're under this health crisis. They streamlined the citizen participation requirements and that we only have to provide 5 days notice. Allow states to be an eligible recipient. And this is one of the waivers that we as a state required because we wanted that flexibility if there were issues that or costs that the state actually incurred early on that would otherwise be eligible. And if you're familiar with our economic development programs, we do something called pre-agreement cost approval, and this is very similar to that. Although with our state CDBG program, we don't fund a lot of public services, but that by statute, the public service cap was waived. So again, generally eligible activities as long as they prevent, prepare, and respond to coronavirus. Okay, John? One of the other differences is that under this program, there's a major emphasis on the prevention, avoidance of duplication of benefits. If anyone on the call is a recipient of CDBG disaster recovery, you have heard this language used a lot. And this is a requirement that grantees prevent the duplication of benefits that is caused when a person, household, business, or other entity receives financial assistance from multiple sources for the same purpose, and the total assistance is more than the total need. We also have a very aggressive implementation. 80% of the funding must be spent in 3 years after the award and close out in 6. Now, Georgia's allocation was almost $83 million. And the CARES Act directed HUD to make these allocations in a total of 3 rounds, similar to what John described for the ESG and HOPWA programs. And the reason Georgia got such a big award is that the factors included public health needs, risk of transmission for coronavirus, the number of cases compared to the national average, economic and housing disruption. And as we all remember, early on, Georgia was hit especially hard, and Southwest Georgia, the Albany and Daughtry area made national news quite often. So all of this played into our large award. Okay, eligible activities, John, you've gotten a little bit ahead of me, include that still must meet one of 3 national objectives. One is benefit to low mod. The other is urgent need, which is similar to our immediate threat and danger program, or economic development for job retention or creation. And one of the things that we liked was that HUD is implementing the is setting the limit on corona-related purposes, but rather than expressly prohibiting grantees from undertaking any activity, they have been very specific in saying, prove your need, and we will consider it. So the state, we have spent considerable time thinking what are activities in the state that have been particularly hard hit as a result of the coronavirus. And 2 activities that we're looking at that you may not have thought much about, but are eligible activities, is broadband. We've had 10 hospitals in the rural hospitals in the state closed between 2000 and 2010. 7 have closed since 2010, and 2 more are scheduled to close in rural Georgia at the end of October. We realize the use of telemedicine is increased tremendously. So those were just 2 activities that we were considering, and that's we wanted to show you that because those are not normal activities that most of you who are familiar with CDBG might think about first out of the hat. The emergency rental assistance, which would potentially supplement our ESG program, is something we're familiar with. We are having ongoing discussions with HUD at the highest levels to explain the broadband needs and how we think as a state we could potentially apply for them. Next. Okay, so why, and on the broadband, the education, the kids aren't in school, they're trying to get on to do work from home, healthcare, as I mentioned, and our local businesses have been tremendously affected. Okay, so what's next? Next slide, please. Okay, there was one missing over there. Okay, so what's next is similar to what our local governments do when they apply to DCA. We as an agency make our annual application to HUD, and when there's a difference in the application similar to our grantees, you have to go in for an amendment. So that's what our next steps are, is that once we get to a point to where we're ready to apply for an amendment, we'll hold a public hearing. It'll be a virtual, and we will make application to HUD, and that once we get an award, we will enter into a contract with HUD, and the contract, similar to our grantee, may include special conditions that are unique to CDBG-CB. And I think my last slide, John, is the map you showed us. And I'm going to give a little teaser for the session on tomorrow that Dina Perry, our broadband director, will give on broadband. This is the interactive map that has just been completed for and to identify holes in broadband in the state. And the lighter colors are those areas that are lacking and where service is limited or non-existent. So I would encourage you to go around and play with that. And if there's any room left for the session tomorrow, please sign up. She'll do a really good job. So with that, I know we don't have much time left, but give me a call.
All right, thank you, Joni, and thank you, Marion, and thank you, John, and thank you, Corin, for all of that information and for the presentation. We are just right at the end of our time for the day, but I noticed a couple of questions have been answered in the chat, and there is one question about broadband funding. There's going to be a great deal of information on that session that is coming up. And so I will leave that question to that session. But again, we thank you all for attending. It's been a great session, and thank our presenters for all of that great information. And as we said in the beginning of the presentation, all of this information will be available and republished for your viewing and sharing at the end of the fall conference. So thank you all for attending, and have a great day.